No one wants to think about hospice care for themselves or a family member. However, it can be the best gift to give a loved one at the end of life. Our first guest is here to explain more about hospice and how you can choose the right hospice for your loved one. Please welcome Rod Robinson, Assistant Administrator of Baptist Trinity Home Care and Hospice. Welcome, Rod.
Thanks, Mr. Castellaw.
Now, once a patient is diagnosed with a terminal illness, what are the options?
So for hospice options, most patients actually stay at home for hospice care, but they can also be in the hospital, they can be in a nursing home, or they can be in a residential hospice like here at the Baptist Reynolds Hospice House.
Now, if they choose this as an option,
yes,
how do they enter this facility? Do they have to be transferred from a hospital, like a nursing home deal, where you have to be in the hospital to go to the nursing home, or can you do the home hospice for a while and then be transferred here? How does that work?
Yeah, there's a lot of different options for that. They can come straight from the hospital here. We need a referral from a physician, of course, but they can do that. If we have patients at home who families get to the point where they can't care for them anymore, we can move them out to the hospice house, or they can even come from a nursing home out here. So all the options that you mentioned are possible.
Now, you raised a good point, and that's about the doctors. If someone is dealing with a particular doctor with their illness, say an oncologist or whatever, how does that work when they come here? Are their doctors still involved in their care, or are there doctors here that care for the patient?
Yeah, we have a medical director here at the hospice house who normally takes over that care. Physicians can still follow their patients if they choose to do that, but most of the time their attending physician will turn over care to the medical director here at the house.
So you have a doctor here. Who is that?
Dr. Joy Burback.
Burback.
And then we also have a nurse practitioner here every day also, Pat Keene, that helps.
Okay. Now, the next question I always get asked when we start talking about hospice is, what will Medicare cover?
Right. So Medicare and most insurances will cover the cost care of the patient, meaning the nursing care, all the personnel that come to see the patient, their medications, any equipment that's needed. But at the hospice house, the part that Medicare doesn't cover is the room and board piece.
Now, how much is that?
Right now it's $195 a day for that. If patients have problems paying that amount, we have a foundation fund that we actually look at the patient's income, and we base a sliding scale on that. So they may pay 50% of that $195, they may pay 0% of that $195, just depending on how they fall.
Now, what about people that have long-term care insurance? How does that play into that?
We always look into that for patients and their families. What we have found is the majority of them do not cover any of that. But sometimes it will, but we will always look at their policy to see if we can get something out of it.
So if someone chooses hospice, like this particular hospice facility, you'll work with them on the financial side of
Yes,
it
sir.
as well.
Yes, sir.
Now, what support do you have here for the family? You know, the patient's going to be taken care of in the medical setting. What about the family, the wives, the husbands that come with them? What do you provide to help them?
Well, what's interesting about that is 5 years ago when we built the hospice house, I never thought I would use it for my family. And my dad was here a year ago. And what happened with that situation is it allowed my mom to be the wife, it allowed me to be the son, and not to be the caregiver per se. So our nurses, our CNAs, our social workers, we have chaplain and volunteers help that family through all of this. And then we have our bereavement center that's attached here to the house. So families can get pre-bereavement services or pre-grief services prior to a patient's death, and then we will follow that family for 13 months after the death.
Well, what you said I think is so important is that patients oftentimes want to take their loved ones home, but then they're having to deal with their care. They can't really be there to help grieve with them and love on them in their last days. But a facility like this, you don't have to worry about caring for them. They'll be taken care of. They can just focus in on what you said, loving on them and being with them in their last days.
It's so important, so important.
Well, thank you so much for being here with us today.
Appreciate it.
Putting a loved one in hospice care may be the toughest decision a family can make. Up next, we'll talk to 3 people who made that brave choice and whether they would do it again. Stay tuned.